A study on association between hearing problems and mental factors. Dr. Youngju Ji, Dr. Samsuk Kim. Introduction. The extension of life expectancy due to medical advancement fueled by the improvement of healthcare and socio-economic development since the 21st century led to a rapid increase in the elderly population. The presbycusis, elderly hearing loss, has become an important issue as such life extension has made quality of life to be attended. The presbycusis, a difficulty in hearing sound due to hearing loss by aging, usually occurred in the 40s and exacerbated by the 50s. The hearing loss is defined as a condition in which the sound of normal conversation corresponding to 40 decibel or less is not heard. The presbycusis is recognized as an important disease in that it causes adverse effects such as personal social isolation, self-esteem, social activity, psychological alienation, depression, and the quality of life by interfering with free and efficient communication. Efforts to reduce stress and the practice of healthy living style are one of the ways to decrease the risk of the presbycusis, as well as prevent many diseases. A recent study reported that the hearing loss also affected sleep time, a mental health index, suggesting that the presbycusis is highly correlated with variables that determine the mental health. The purpose of this study was accordingly to investigate the relationship between mental health variables and the degree of hearing using raw data from the 7th National Health and Nutrition Examination Survey (NHNES) in the population in their 40s and over, when the hearing loss occurs generally. Method. This descriptive survey study was to investigate the relationship between mental health variables and the degree of hearing using raw data from the 7th NHNES in the population in their 40s and over when the hearing loss occurs generally. From the 192 sample survey district included in the 7th NHNES, after excluding facilities such as nursing homes, military facilities, prisons, and foreign households, appropriate households were determined, and among which 23 sample households were selected using the systemic sampling method. Or the members of the selected household who are over 1 year old and meet the requirements of appropriate household members were included in the analysis. Of the total 8,127 data, only hearing test subjects aged 40 years or older were selected. The data in which the variables used in this study such as gender, age, education level, quality of life, economic activity status, average daily sleep time during weekdays, perceived level of user stress, presence of depressed feeling for 2 consecutive weeks were omitted. Non-responded were excluded, resulting in 4,197 data used in the analysis of this study. The questionnaires used in this study was designed to measure general characteristics, gender, age, level of education, economic activity status, average daily sleep time during weekdays, perceived stress level in daily life, presence of depressed feeling for 2 consecutive weeks, and quality of life. The average sleep time during weekdays was calculated in minutes using the time of going to bed and waking up. The level of usual stress indicates the degree of feeling stress in everyday life. The presence of depressed feeling for 2 consecutive weeks were measured using the responses yes or no for the question of did you experience the depressed feeling for 2 consecutive weeks? The quality of life was measured by a combination of 5 levels of health-related quality of life: mobility, self-care, user activities, pain or discomfort, anxiety or depression. The general characteristics: average daily sleep time during weekdays, perceived level of user stress, presence of depressed feeling for 2 consecutive weeks, and quality of life of subjects were analyzed using the descriptive statistics. The difference in average daily sleep time during weekdays, perceived level of user stress, presence of depressed feeling for 2 consecutive weeks, and quality of life by degree of hearing were analyzed using ANOVA and post-tested using Turkey HSD. The associations among average daily sleep time during weekdays, perceived level of user stress, presence of depressed feeling for 2 consecutive weeks, quality of life, and degree of hearing were measured using the Pearson's correlation coefficients. Oral statistics procedures were conducted using IBM SPSS-20 program. This is a descriptive survey study to investigate the relationship between mental health variables and the degree of hearing using raw data from the 7th NHNES. In the population in 40s and over, when the hearing loss occurs generally. The results showed that the score of degree of hearing in those of 40s and over was 1.22052, indicating mild problems in hearing. The lower degree of hearing was shown to have more negative effects on average daily sleep time during weekdays. Presence of depressed feeling for 2 consecutive weeks and quality of life, and had no statistically significant association with the perceived level of user stress. The decrease in hearing level, as shown by above results, has negative effects many mental health-related variables after middle age, indicating the necessity of habits to maintain hearing health such as noise prevention in workplace, decreased earphone use, and early treatment of inflammatory disease related to ear. It is also considered that for the populations with hearing loss, the development and application of various convergence intervention programs are needed. This study has a limitation in generalization of the results since it is a secondary analysis of existing national data. The replicate studies are recommended to focus on the subjects and the hearing problems of 40s and over and compare their results with those of this study.